Hi, this is Dr. Epstein, and it's a pleasure to answer the question regarding the downside or risk of doing megasession procedures, which in the question as posed was a 3,000 graft or greater procedure. Concern is, do megasessions predispose patients to having widened scars? And the patient was confused because those doctors that don't do megasessions, their rationale was the risk of the scarring, while those doctors that do megasessions, such as myself, our explanation is that megasessions are superior because why not get the most amount of coverage, and that the risk of scarring within certain, as long as a certain size donor size graft is taken, donor size strip is taken, do not predispose you to getting a scar. And I would agree that, it's the old saying, if you have a hammer, everything looks like a nail. Many doctors will use as justification for why they are unable to do megasession procedures, which require a large team of 5 or 6, or in my case I use as many as 10 assistants or 11 assistants in a single large procedure. And they'll use as their rationale, well, these larger procedures have a downside, and the two downsides they refer to most commonly are, number one, a risk of a widened scar, and number two is poor graft yield or poor growth of the hairs. I think that every case it has to be individualized. The average size procedure that I personally perform is around 2,700 to 2,800 grafts, but in some cases we'll do as many as 4,000 grafts, while in other patients I'll feel that the safest number of grafts I can get is 22 to 2,300. That, of course, is on patients that are looking for the maximum number of grafts. Those decisions are made based on, in my case, 15 plus years of experience in performing these procedures. I'll assess scalp laxity, donor supplier density, and also if there's any scarring. Of course, if there's scarring from a prior procedure, the number of grafts we can get is even lower. Scarring is due to a lot of things. Any doctor that says he never gets a scar is not being honest. On the other hand, scarring can be reduced by careful patient choice and the procedure choice, and also using good technique to close the donor site. In the majority of cases, I'll use a single layer closure with a trichophytic or hair growth through the scar HITS technique, HITS technique is as I call it. In other patients, especially those having secondary procedures, I'll use deep sutures, doing a more of a plastic surgery type closure, and I feel that those are preferable in those patients. In terms of graft yield is due to a lot of factors. Number one is careful handling of the grafts, not letting them dry out, and having experienced technicians or assistants. In my office, I have a team of 15 full-time assistants. They work full-time for me. The average one's been with me for 7 years, and this provides me with a tremendous amount of confidence in knowing that these girls not only know how to dissect the grafts, they also know how to keep them moist, and lastly, they know how to plant them. They know how to plant them atraumatically. So the bottom line is, or the answer is, that every case needs to be individualized. If a top surgeon feels that you are a good candidate for a 3,000 plus graft procedure, I think you have to decide if you trust that surgeon enough, and I think it's important to look at prior work, look at photos, and perhaps even talk with the patients, the doctor's patients, to get a good feel for the kind of work that he or she is able to perform. But it's important to do your homework, look at the website, photos, and just make sure you're making the right choice and trust your doctor, because if you don't trust your doctor, then you have to think twice about the procedure you're having performed. Anyway, this is Dr. Epstein. It's been a pleasure. I hope that person didn't mind me not answering his phone call, but my front office picked it up. Anyway, thanks. This is Dr. Epstein.